health and welfare. Next class will be your 401k pension. These gentlemen are not members of our local, they're guests here, they're outside of their working time, so I ask that we give them, respect. Find yourself knocking off, those off, stand up, do whatever you gotta do. But, give them some respect. If you have questions, this is the time to ask, take notes, as well as tonight, we are going to be filming this. This is gonna be recorded for the whole entire body to have access to, right? So that's what I've heard. You got anything?
I'd like to say this is just gonna be put on our website. We're trying to make more awareness to our membership and give them access to see what's actually taught in these classes, so. It's basically for our health, our welfare, intervention, so. Just to bring more awareness, give another option for membership. But like I say, please remember this is being important.
Does everybody have a Genesis folder? If not, come on up, we'll get you one.
I actually put them on the back, on the tail on the back there, Jason.
Somebody need one? Oh, okay, thank you. Yep, there are some in the back. Does anybody want an extra for a spouse or loved one? All right.
Thanks, Jason. Thanks, Kurt. So yeah, Jason said, my name's Bryce. This is Jim. We work with Benesis. We administer your health and welfare fund, your profit sharing 401k, as well as your pension fund. Tonight, we're gonna just go through the health and welfare fund, as well as at the end, we're gonna give you a quick tutorial of your website as well. And then next week, we're gonna be back to talk about the profit sharing 401k, as well as the pension. So I'm gonna ask you, those folders we handed out, everything that's on the right side, that's what we're gonna be going through today. Everything on the left side is what we're gonna go through next week, so try to remember to bring those folders back next week. We won't have a ton of extra copies that, if too many people forget. But it will be, everything on the left side is what we're gonna go through next week, so. So I guess before we get started, are there any pre-apprentices or metal tradesmen here? Or are we all apprentices? Anybody? Okay. That will play into effect a little bit later, I guess. And is anybody here already eligible in the health and welfare plan, or have any, used it, had any claims paid? Anybody like to go in? A few? Okay. And some of you may not know if you're right on that cusp line of being eligible, so we can figure that out for you too. But wanted to start off, again, in that right side of your packet. This is your current board of trustees for the health and welfare fund. So this group of people, they meet 8 times a year to make decisions regarding your plan, to obviously look at claims that are being paid, money that's coming in, how it's doing. They also hear appeals from members at all those meetings. We just had one. The most recent one was last week. So if there's ever things you want, questions you have, obviously you can call Jim or I. If you're here at the hall, a lot of these guys are working here. You're probably familiar with some of the names. They're a resource for you. If there's ever something you think should be changed about the health fund, this is a group of people you can speak to, and they can bring that to the board on your behalf. We'll go through a lot of the details of the plan as the night goes on. Something I always want to bring up is if there's something that you disagree with, you have a health claim and it gets denied, or the plan doesn't cover it for whatever reason, you think that it should be covered. The way you're interpreting the plan, you think it should be covered, or it's a unique situation. You all, as members of Local 400, have the right to appeal to this group of people, and they hear those appeals at every meeting. Again, like I said, 8 times a year, they meet twice a quarter. And a lot of the times, it's a unique situation, and they may put a new rule in the plan that works for the situation you're looking to have covered or whatever it is. So that's the right you guys all have. I just want to make you aware of it. Worst thing that can happen is they say no, and you're in the same spot you initially were. So
So before we move on, I think it's important to note that the local 400 health fund is different than what you may think of as a traditional insurance program. Your health fund, much like other union health funds, not only in the Midwest, but across the country, are actually a self-funded health fund. It is not fully insured. So if you have brother, sister, mom, dad, cousin, who tells you, well, I'm through my insurance at work, 9 times out of 10, that's going to be different than a union health fund. Legally, it's called a Taft-Hartley Health Fund. And as I mentioned, it's actually self-funded, meaning every contribution, health fund contribution, hourly contribution that comes in from your signatory contractor goes into one huge kitty. And that kitty resides at Associated Bank. And right now you got about $75 million in that kitty. It is that money that actually process or pays for all the claims and all the expenses associated with your health fund. So unlike your mom's plan or your dad's plan or your sister's plan, where they would typically have what we call a fully insured arrangement, that fully insured arrangement is through a insurance company. So whether it's Humana or Blue Cross or United Healthcare, or whoever it might be. In your case, and I say this every time we get together with apprentices, you are the insurance company. Everybody sitting here today, all your other union local 400 brothers and sisters, you are the insurance company. And it's those individuals that Bryce has listed up on the screen there for you that actually determine what's in this plan and what's not in this plan. So you're not going through an insurance company per se. You are it. Okay. Now, for those of you who said that you are already in the plan, should be walking around with a white card, it says United Healthcare on it. And in the upper left-hand corner, it says Local 400 Health and Welfare Fund. Okay. And you'd say, well, Jim, it says United Healthcare on it. Aren't we through United Healthcare? Technically, no. United Healthcare is an insurance company, yes. But United Healthcare only provides one service to you. And that service is they are the entity that discounts claims before they get to the fund office for processing. Okay, so you're not fully insured with United Healthcare. So whether you go to your clinic, whether you go to the physician, whether you go to the hospital, doesn't matter where you go, and they ask you for your card, and they ask you what insurance you're with, I strongly recommend you tell them you are with the Local 400 Health and Welfare Fund, because you are the insurance company. You pay your own claims, you pay all your own expenses. That is different from the traditional single employer model, where it's a fully insured product. Okay? You're not alone. All your union brothers and sisters are set up the same way. Doesn't matter if you're a laborer, sheet metal worker, carpenter, electrician. They're all set up just like you are. Okay? And there are some distinct differences between how you guys are set up and how basically the rest of the world is set up. And we'll go through some of those things here in the presentation so you understand how it might differ from your mom and dad's plan or your brother or sister's plan. Okay.
Jim, could you explain real quick the thumbnail, the advantage to being self-funded versus fully insured?
Yeah, Jason, that's actually a good question. We get asked that quite a bit. Because thankfully you haven't been in this position financially. You guys, as you'll find out here shortly, are in really good, healthy financial position, no pun intended. But we're commonly asked, why wouldn't we just go through an insurance company and be fully insured instead of being self-funded? There is one primary reason, and that's because it's cheaper. It's cheaper being self-funded if you can afford it, which you can. Than it is being fully insured, because a fully insured product, at least in the state of Wisconsin, has a state tax that goes along with it. That state tax is 10%. So if a claim, for example, was $50,000, there's a 10% state tax that goes along with the processing of that claim. You don't have that in your fund, you're self-funded. So that is the primary reason why organizations like yourself remain self-funded versus fully insured, because it's cheaper than than a fully insured.
All right, so the first thing we're gonna get you guys is eligibility. One, how you establish your eligibility initially, and then, probably more importantly going forward, how you maintain that eligibility from month to month. So that the top section pertains to pre-apprentices and metal tradesmen. We didn't have any of those here, so we'll focus here on this bottom section. For those of you who are not already eligible, you have to work 260 hours in total. Doesn't have to be in the same month, but once you hit your 260th hour, what's gonna happen is there's gonna be essentially a month gap, and then the first day of the second month following you hitting 260, you are gonna be eligible for coverage. And at that point, that white UHC card Jim was mentioning, that's when we're gonna have that to you in the mail. Your coverage is gonna start as of that day. Maintaining your eligibility going forward works a little bit differently. Before we get into that, if there are any of you who maybe are just starting out, and you do not want to wait until you work that 260th hour and then, wait till the second month after that, you can buy in for your eligibility, and you can get it a little bit earlier. So right now, just for your health insurance, the monthly premium is $1,222. You'll see it's listed a little bit below here in your packets. If you want one of the dental plans, that adds either $84 for Care Plus or $93 for Delta Dental. But if you don't want to wait that amount of time, you can buy in either 1 month early or 2 months early, and then pay obviously either $1,222 or for 2 months, $24.44. Once you are eligible, your eligibility goes on what I like to call it's like a 3-month lag. So this chart shows you the month you work, what month that's actually buying your coverage for. So for those of you who are eligible, and we're in the month of January, your hourly requirement per month to stay eligible is 130 hours. If you have one of the dental plans, that goes up, I like to think of it as an extra 10 hours. It's really close. If you're in Delta Dental, it's like an extra 9.8 hours a month. And if you're in Care Plus, it's a little bit under 9 hours. So call it 140 for the dental plan. For purposes of just, this example, say you don't have the dental coverage, you have to work 130 hours a month to stay eligible. We're currently in the month of January. So your 130 hours gets worked. That covers you, not for February or March, it actually covers you for April. So you're only 3 months behind your eligibility. Now, what does that mean? It means, let's say you don't work enough hours or something happens and you're not working anymore, you actually have 3 months of health coverage left before that's going to run out. And I know, Jim, you have a good explanation as to why there is that lag, so I'll let you explain that.
Yeah, thanks, Bryce. So for starters, we talked about what are some of the distinct differences, right? Here is one of the distinct differences between a union health fund and a typical single employer health fund. In a single employer world, like Bryce and I, when Benesis wants to provide coverage for us for the month of February, they'll cut a check on January 20th, send it off to the insurance carrier, and Bryce and I are covered for the month of February. That's how it works. In union plans, that's not the case, obviously. It's based on your hours worked, and it's based on the amount of hours needed in order to maintain your eligibility going forward. So to Bryce's earlier point, I mean, what you want to do consistently, if you can, And I know work isn't always good. Work ebbs and flows. We have good years and we have bad years. You want to maintain at least 130 hours a month in order to maintain your eligibility going forward. Why the 3-month lag? Why the hell does it take you guys so long in order to provide us with eligibility? Well, again, here's a distinct difference between us and the single employer world. Your collective bargaining agreement calls for your signatory contractors to disseminate out of their hands no later than the 15th of the month following the month worked, all contributions that are due and payable on your behalf. And when I say all contributions, I'm talking about your health fund, I'm talking about your retirement plans, I'm talking about dues, I'm talking about your building fund, I'm talking about your fraternity fund. All those contributions have to be out of the contractor's hands no later than the 15th of the month following the month worked. So as we sit here in January, and you guys hopefully have been working through the first course here this month, the employer is able to accumulate those contributions that are due and owed you and pay that money no later than February 15th. That's what the collective bargaining agreement calls for. Now, again, what's a little unique in your world, that's not in the single employer world, is, and guys at the table, please correct me if I'm wrong, you have over 140 signatory contractors to local 400. Okay. And some of you actually move from contractor to contractor in any given month. So even though all these monies are sitting over at Associated Bank and they're all sitting in a pool, it's Bennis's job, we're under a contractual obligation, in order to segregate those dollars by member and make sure that by the end of that month, those monies are then dispersed to the respective entities. So let's use January for an example. You guys are working in January. February 15th is the latest an employer can have those monies out of their hands, goes to the bank. We then reconcile everyone's accounts and we make sure that those get posted by the end of February. So already we have a 1 month lag because we're waiting for the money to come in and we're waiting for that to be reconciled. Then the next month, we go ahead and we forward that information off to the respective entities. So if the health fund is due X amount of dollars, the retirement plan is due Y, dues gets this, fraternity gets this, we segregate all of that out. Okay, so that there is a period of time where those transactions get take place, and they're actually confirmed by the respective bodies. So whether it's the union confirming the union dues are accurate, whether it's us at the health fund confirming, yep, that's what we were expecting, all of that takes place. Then the next month is when you ultimately get your eligibility, because the law says we have to have the money in our coffers, meaning the health fund coffers or retirement coffers, before we can extend eligibility to you. I can't extend an eligibility to this gentleman up front if I don't have the money in the health and welfare. So that's why the lag. You don't see that in single employer plans, but it's very common in union plans like yours.
Very real quick, with that being said, remember when we started this class, I mentioned that there's a few key points, highlights that we want you to remember. Here's one that pertains to that. How many people here have had to work out of this local area? I know we just had one come up and say, okay, no matter if you're foreman or the company or who didn't send you somewhere or Bassett, it does not matter. They say we've taken care of all the paperwork, or you talk to a steward on the job site. When you are outside of your own local, it is imperative, this is a must, remember this, that you, the worker, has to take it upon yourself to check in with that union. Okay, make sure your paper and your reciprocities and all that stuff's in order, so that all this stuff can get back to you. Does that make sense? You get out of town, you're working in a different local, you, at a very minimum, need to make a phone call. I suggest you make a physical presence at that visiting union. Okay, don't forget it. It's very important.
Thank you.
Yeah, Jason, if I could piggyback off of that, that's critical, thank you, because, the international, about, oh boy, 7 or 8 years ago now, maybe longer, implemented what they called UARS, it's the United Association Reciprocal System. And what that system was intended to do was to make sure that as men and women traveled around the country to different UA locals, that the monies that would be paid, that would be due and owed to them, come back to their home fund. There was a time when that system wasn't in place, where if you specifically worked on the West Coast, and I apologize for constantly picking on the West Coast, but they tend to have this history. And you would be working there for 1, 2, or 3 months. It is not unreasonable for our office to think, we're not going to get those monies for at least another 6 or 7 months. They would hang on to it. And they would send it when they felt like it, essentially. Hence the reason the UA ended up putting in this national UARS system. It has helped immensely, because what has it done? It's required every UA local across the country to make sure that those reciprocal monies are reciprocated back monthly. So California couldn't do one thing and New York could do another, or Michigan do another. No, everybody's on the same page, and we do as well. If there happens to be a member from another local that comes into local 400's jurisdiction, we are under a contractual obligation to make sure that that gets reciprocated back within a month. That's helpful to you, obviously, if you're working outside the jurisdiction, because especially when it comes to the health fund, it is those health fund hours that are determining your eligibility. So we want to make sure that money gets into your account as soon as possible. So you should gain comfort in the fact that the UA actually took the initiative to do this, because it's helped a number of traveling members, whether it's local 400 or any other local, get their eligibility extended in a more timely fashion.
All right, guys, now we're gonna dive a little bit further into how that 130 hours a month actually breaks out. You look at your hourly contribution rate, so if you want to actually skip past the next 2 packets of these flow charts, we're gonna come back to them. But the single page right after it breaks down your plan a little bit. We're gonna look at the top section for now, which just talks about the contribution rate. So currently, this is as of June 1st of 2024. Your base hourly contribution rate is $9.40 an hour. You also, your employer on your behalf pays 65 cents an hour just to the general fund. But for purposes of your true health costs, your true health premiums, we're gonna use this $9.40. And if you take that times 130 hours, which we've already said is your monthly work hour requirement, that's where we get this $1,222, which is your monthly premium total cost. Like I said, if you wanted to buy in for early coverage, this is the exact dollar amount per pay. Obviously, if you have one of the dental programs, which we'll go through in further detail later, that number goes up a little bit, but your base cost is $1,222. So every single hour you guys work, that $9.40 plus 65, in reality it's $610.05, is going into the health fund on your behalf. So what happens when you hit that 130th hour? And obviously when work is good, like Jim said, it is always, but when it is good, 130 hours really isn't that much to work in a month, and you guys are typically blowing way past that. Your employer is still required to contribute that same dollar amount on your behalf for every single hour, whether it's the first one, 130th, or 200th of the month. But what happens once you pay your eligibility requirement is that $9.40 portion builds up into what's called your member dollar bank. And if any of you have worked in other industries, you may have had like an HRA or an HSA. This is fairly similar to that and how it works. There's two reasons that you can use your member dollar bank, or 2 purposes. One of them is to reimburse yourself for any medical costs you may have incurred out of pocket. But the other one is actually to extend your eligibility in the event you aren't working enough. So in the example that you work 160 hours a month, and we'll go through this on some of these earlier flow charts, that 30 extra hours, that's gonna build up in your member dollar bank. So 30 times 940, that's how much goes into your member dollar bank for that month. Let's say you're working like that for a while, but then you have a month where maybe you go on vacation or something happens, you can't work the whole month, you work 120 hours, so you're 10 hours short. But we're not just gonna boot you out of the health fund for being 10 hours short in 1 month. What we're gonna do is say, well, you were 10 hours short, $9.40 an hour, and we're gonna pull $94 from your member dollar bank that you've been, hopefully building up in the months prior. The only time you're ever gonna get really any sort of a self-pay notice in the mail and is if you do not have enough money in your member dollar bank to extend your eligibility. So if you've had a few months in a row, maybe you're not working enough. Your member dollar bank goes to zero and you still owe for that month, we are gonna send you what's called a self-pay notice. You're gonna have 20 days to pay that from the time you get it to our office. And then you essentially have to write the health fund a check for the remainder of your eligibility for that given month. In the event that you do not make that self-pay, say you're like, oh, I don't have to go to the doctor this month. I don't care if I have health insurance right now. Fine, that's your decision, but you're not just losing health insurance for that month. You're actually going all the way back to the beginning and you have to reinstate, initial eligibility all over again. So that first slide you showed here, the second slide, I guess, where you gotta work the 260 hours and then wait a couple of months. You have to go through that whole period again. You won't be insured until you have gone through that process. So if you ever do get a self-pay notice, typically it's better off to just pay it. And hopefully you're working enough that it's never something that affects any of you guys, but something I wanted to point out. Now, I mentioned there's another way you can use your member dollar bank, and that's if you incur any out-of-pocket medical expenses, you can get that reimbursed from your member dollar bank. The catch on that is currently your plan requires you to have at least 2 months of eligibility. Your plan has, easy way to think of it is a floor, and there's also a ceiling to your member dollar banks. But the floor means right now your eligibility is $12.22 a month. That times 2 is $24.44. You have to have that much built up in your member dollar bank before the fund will start reimbursing for any out-of-pocket expenses. And the reason that rule is in there is to protect you from, maybe you want to reimburse constantly and you're always keeping that member dollar bank down at zero, but now you have a month where you can't work and you're gonna have to owe the entire premium all on your own. That 2-month buffer prevents that from happening for any member. It gives you at least 2 extra months of coverage in the event that, something catastrophic were happening, you couldn't work, whatever the reason may be, that at least is there to extend your coverage for a while. I mentioned there's a ceiling as well, so if you want to go back to the beginning of that first flow chart, the one that has had a bargaining unit employee on it. A few years back, your trustee implemented a policy to put a cap on how much money you can have in your member dollar bank. That cap is not a hard and fast number. It's based on 12 months of eligibility. So, June 1st, your health rate could change. It may or may not. If it does change, that's going to change your total monthly premium because it's going to be that new contribution rate times the 130. And it's also going to obviously change what the 2-month floor is and what this 12-month ceiling is. Right now, with the hourly contribution rate at $9.40, the most you can have in your dollar bank is $14,664. And all that is 12 months times that $12.22 a month eligibility rate. So, I know a lot of you guys are new, most of you guys are new. Obviously, you're just starting to build your dollar banks. It's gonna take you a long time to hit this ceiling, but it does happen. And there's certainly plenty of members in your fund that are at this cap for their member dollar banks. So what happens then? If you're still working over 130 hours, but you can't put any of that money into your dollar bank, where does it go? So again, Jim, I'm not sure exactly how many years ago, but not too long ago, when this was implemented, your trustees decided, well, it's not really fair to just put all that money in the general fund and give none of it to you. So what they did was anything over your 130 hours in a month that would typically go to your dollar bank, but in the event your dollar bank is maxed out, half of that money is going to go to the general fund, but the other half is actually gonna go into your profit sharing plan, which we're gonna get into, more detail on next week. But it's gonna leave the health fund and it's gonna go into a retirement account for you. These are some examples. We'll walk through in a second, but Jim, I know you had a little more history on the decision there.
Yeah, so, yeah, it's been, at least 5 or 6 years now since we've had this in place, and the primary reason that the trustee did it is your trustees, measure the financial solvency of your health fund in what we call a months of reserve calculation. And currently, that sits at almost 18 months. The best way I can explain that, as far as what that means, is if we didn't take in another dime, not one dime, and we experience the same medical claims and expenses that we have over the course of, say, 2024, this fund could actually go 18 months without ever taking in another dime. For the record, that's impressive. Other funds that we work with hover in the 4 to 6 range, 4 to 6 month range. There was a period of time not too long ago, we were up around 24, 25 months. So we almost had 2 months or 2 years, excuse me, of reserves. So when we were at that point, the trustees, obviously didn't want to put themselves in a position where your health fund became a retirement plan, because you've already got 2 of those. And they wanted to put in a mechanism that would allow for some of the overage that was normally going into the general health fund back to you, the members. Because it's important to note, and Jason talks about some of the key things that come out of tonight's presentation. One of the things I want to make sure everybody in this room understands, your dollar banks, although on paper are allocated to you, are owners of the fund. Okay, what do I mean by that? Well, God forbid we ever get into dire straits, which I don't anticipate we will ever do. Your trustees do a great job. They're very financially responsible. But if that were to ever take place, under law, we have every authority to go ahead and to dip into those dollar banks to pay claims. Okay. So when I first started with you back in 2001, dating myself here, Gene Van Langfeld, for those of you who might remember Gene, I know these guys up here do, was the business manager. And Gene asked me to go lunch with him because he wanted to go from in-house administration to a firm such as ours. And we had already been administering his 498, or 458, excuse me, 458 401k plan. And he says, I would like you guys to administer our health fund. I said, okay, that'd be great. I said, well, can you do me a favor? Can you give me the most recent financial statement for your health fund so I can see how you're doing financially? Well, I took a look at the first page and realized we were in trouble. So when we got to lunch, I said, Gene, thank you for sending that to me. I appreciate it. I said, but we're coming in under some dire circumstances. I said, because your fund isn't as healthy as I was hoping it would be. He says, what do you mean? He says, Jim, we got over $9 million in our fund. I said, yeah, you do. I said, but all 9 million are in dollar banks, and that's an encumbered asset. I said, so if we ever have a bad year in claims, are you okay with us dipping into your members' dollar banks in order to pay claims? Well, needless to say, Gene said, no, I'm not okay with that. And so over the course of the next 5 years, through Gary Young's administration and part of Mark Buss's administration, Local 400 members back at that time, which would have been the early 2000s, put in their whole wage allocation into the health fund. And they swore they would never go back to those days again. And that we were always going to have a healthy reserve position. And here we are today, some 24 years later. And you are without question one of the healthiest health funds, union health funds, at least in the Midwest. I don't know if I can speak about the whole country, but certainly in the Midwest. So I applaud not only you for continuing those efforts, but your predecessors before you. I call them more mature, meaning older members, because they're the ones that bit the bullet and ended up taking that venture on. So with that being said, we were in a really healthy position 5 or 6 years ago. And the trustees didn't want this to be a pension fund. So they said, how do we give money back? How do we give money back to the members? But Jim, we don't want it to be in the way of a dollar bank, because you're telling us that dollar banks really aren't the members' money, it's the fund's money. So with the assistance of fund counsel and the fund consultant, this program was implemented so that when you got to a certain level of your dollar bank, it would actually separate any overage, and half of it would go to the profit sharing plan and the other half would go back to the general fund. So they're basically sharing it with you 50-50. Okay, what's the difference? Well, the difference is when it was a dollar bank money, it really wasn't your money. It was the fund's money. When we send that money to the profit sharing plan, we have no control over it. It's your money. And you're vested in it from day one. We'll talk about vesting next week, but meaning it's your money from day one, the minute that dollar goes over there. So now each and every one of you, as you exceed this rolling 12-month cap, are going to generate dollars that are going to go into your profit sharing plan, which you're already all contributing to as part of your hourly contribution.
So every class or even members throughout the local will ask me, I'm sure Kurt gets asked this, Robbie. That's a lot of stuff to take in, how that money bank works. Are there any questions somebody has right now about this before we get moving on? Is there anybody not too clear on how this works, why a certain amount goes somewhere, why that's beneficial? Is there anybody confused?
Jason, if I could, can we go through an example that's going to apply to everybody?
Oh, sure. Okay.
So let's take scenario 1B.
It's on the right side of that.
This is the one that's on the right side. I'll try to talk loud. This is probably going to apply to 95% of the people in the room. As Bryce said, the rolling cap is 14,664, but none of you are there yet. Okay. So we've got a mandatory 130 hours that we need to extend our eligibility. So if I've got somebody that's working 160 hours, that's that top block. What ends up happening is we take that 160 hours times the 940. We take from that total dollar amount $1,222, and we extend your eligibility one more month. And then the remaining money, because you haven't hit the cap, the remaining money goes into your dollar bank. So $282 goes into your dollar bank. Nothing goes into the profit sharing and nothing goes back to the general fund. Now I'm backpedaling here a little bit, but Bryce said there's 65 cents of every hour that goes in the general fund. That's right off the top. Okay, that's going in here regardless. So as you build this money up, you're trying to reach what is the current 14,664. Now, Bryce and I commonly get asked, what if I fall below it? What if I'm at 15,000 in my bank? And I had a daughter who needed braces and my out-of-pocket was $2,000. Well, if you got the 2-month floor that Bryce was referring to, the $2,444, anything over that, you can ask for a reimbursement. So if you got 10 grand in your dollar bank, or in this case, 15,000 in your dollar bank, you can actually request from the fund office a reimbursement of that $2,000 expense, and we'll pay it to you directly. Well, now your $2,000 has taken you below the 14,664, right? Right? So now I've jumped from that scenario back over to this scenario. If I'm under 14,664, I can build my bank back up. And you keep building it up till you hit that cap. Once you hit that cap, that's when we start divvying the money up. Okay? So everybody understand how that works? So you're working towards building towards that, what is today, the 14,664. Come June 1, that might be 15,000. Because if your hourly health fund contribution rate goes up, that goes along with it. Okay? So I really want you to understand the mechanics behind this, because you're all gonna be in this boat. You're all driving to get to that number. Okay?
Two other things I want to point out in the dollar banks too, guys, before we move on. One, that money, we get money from your employer that goes to the health fund and ultimately to your dollar bank, that's tax free, to you. And when you pull it out, whether it's to reimburse or extend eligibility, you don't pay tax on that. So it is
Good point.
again, a tax-free benefit to you. Jim also did mention that technically, those member dollar banks do always belong to the fund. That also is true if, say, any of you were to leave. Let's say you leave Local 400 and you're gonna go start a new career, doing something else. Whatever you had in your member dollar bank, that cannot follow you to your new career. That is going to be absorbed by the Local 400 health fund. Anything you can't, that you didn't, any reimbursable expense from before you left, you could get reimbursed for that, but anything other than that, it's gonna go back to the fund. It is not a vested asset. Like your 401k is gonna be, able to talk about that next week. So,
Now, the only caveat to that, there is a caveat, and the trustees put this into place about 5-6 years ago. If you happen to transfer to a different local, and we've had probably a handful of guys that have done that. One went to Denver, I forgot where the other 4 went, but if you go to another UA local, your trustees have authorized for the release of your dollar banks to follow you. However, the new local that you're going to has to have an avenue to accept those monies. Okay, so if they have an HRA at local, help me, Rob, 455, is that Minnesota?
Yep.
Wow, good. So you go to local 455 in the Twin Cities, and I know they have an HRA because we work with them from time to time. Your local 400 says, yeah, we're gonna allow you to transfer that money to them, and I know they accept it. So now whatever you have in your bank does follow you. But to Bryce's point, if you decide to stop being a local 400 member and you want to be an administrative manager, sorry, the local 400 health fund absorbs that.
and Jason brought up a good point too, just because this is going out to the whole membership. When you retire, what we typically see the dollar banks being used for, so obviously right now your eligibility is being paid for by your work hours. Well, when you retire, you don't have any work hours coming in to pay for your eligibility. So if you have a decent amount built up in your member dollar bank, that money will pay to essentially extend your eligibility for obviously as long as it can until it runs out. It's the main way that it gets used in retirement.
So technically, before your official retirement date, you could take a little bit of a vacation.
Depending on what you have in your bank.
Problem, you wouldn't do that.
No.
All right, so if anybody does have questions on that at any point, just raise your hand, you can interrupt us as we go. Otherwise, I know we'll probably take one quick break and then Jim and I will be here for a minute afterwards. If anybody has anything really, specific that you want to ask about, we'll be around. But I want to go back to this plan design piece. Now we'll get into a little bit more of the nuts and bolts of the the health insurance aspect of it. So I know we got a lot of people in here who in here has at least one dependent, whether it's a spouse or a child. A pretty good amount, okay, well, I'd say about half. Cool thing about this plan is, doesn't matter if you're a single guy or if you're, married and you have 10 kids, that 130 hours a month you have to work to stay eligible never goes up. You don't have to work extra to have extra people covered. The few differences between being single and, again, having dependents are what's listed on this page. And it's gonna come in your different deductible levels as well as your out-of-pocket maxes. And you have a different level of out-of-pocket maximum for in and out of network. We'll explain this here in a little bit. So I know it can be kind of confusing, but if you look at this, kind of this middle section in between the two bars, it says your in-network level of benefits. So Jim mentioned it before, you have a UHC card. UHC is your preferred provider that discounts your claims. They're not your health insurer, but you have to use an in-network, whether it's a hospital or clinic, in order to get the in-network level of benefits. If you're outside of that, you get obviously the lower section, the out-of-network level of benefits. So it's more beneficial to you guys to stay in-network. And if you're ever having an issue figuring out if a place is in or out of network, that's one of the things just call our office about, and we'll be able to help you out, real quick. So looking at the in-network level, we'll take a single apprentice here as an example. When you look at this deductible, what does deductible mean? That's how much money you have to spend out of your own pocket in a given year to essentially have the plan then kick in. With a few exceptions, and we'll go through those too. But if you're single, it's $1,000. So we're in January right now, 25. Plan just started over. Chances are a lot of you probably haven't gone to the doctor yet this year. You have to spend $1,000 out of pocket before you get to the level where the plan kicks in. This in-network co-insurance where you see 80%, that means once you've spent $1,000, the plan will then cover 80% of any claim you incur. You have to cover the other 20% until you get to this out-of-pocket max. So in the single employee scenario, that is $3,000. So once you spend $1,000, the plan kicks in and covers 80% of any claim until you have spent a total of $3,000. And then the plan covers everything for the remainder of the year. Now I say that, and I want to put an asterisk, that providing it is a expense that is actually covered by the plan. Obviously, some things are not covered by this plan, and we'll get into that in a little bit as well. But again, in that example, once you hit $3,000 for the year, you don't pay anything the rest of the year unless you were to go out of network, which you see down here as a higher out-of-pocket maximum, $4,500. Now you could be on the hook for something if you're no longer in network.
So why don't we give an example? So let's take a claim, you go to the hospital, you incur a claim, and it's a $60,000 claim. That claim then gets sent on to United Healthcare. Again, United Healthcare is your PPO provider. So they're going to take that claim and they have contracts with different service providers, hospitals, clinics, physicians, what have you. They're going to discount that claim down. Right now in your fund, your average PPO discount with United Healthcare is about 54%, as I sit here today, which is actually really good. So basically that $60,000 claim gets written down to $30,000. That gets sent to us for processing. Okay, the claim's already been discounted. So we look at you as an individual. We're sitting here on January 22nd. And we notice that you haven't incurred any claims today. So to Bryce's point, we're going to assess you the first $1,000 deductible. So you're going to pay $1,000 of that $30,000. Now the plan kicks in, and the plan's going to kick in because you went in network. The plan's going to kick in at 80%. So that we take that 80% times the 30,000, that's 24,000. So between the plan paying 24,000 and you paying 1,000, we've already covered $25,000 of, the total discounted claim. Well, there's $5,000 left. Now, Bryce just, informed us that the out-of-pocket limit for, the maximum out-of-pocket limit for an in-network individual is $3,000. You've already paid $1,000 as part of your deductible. So you're on the hook for the next $2,000. Then you've reached your maximum. So of that remaining $5,000 that has to be paid, you pay $2,000, the fund pays the rest. We pay $3,000. So at the end of the day, when we're doing the math, that $30,000 discounted claim, you're paying $3,000 of it, we're paying $27,000. That's how it works. Okay? Now, it came up this afternoon. Well, Jim, Bryce, what if I go out of network? Okay? Well, you're gonna notice from the illustration, both the deductible and the out-of-pocket limit are higher. Because you're not going to a UHC in-network provider. So you're gonna notice that not only are the deductibles and out-of-pockets higher, so is that percentage of what the plan will pay. It drops from 80% to 60%. So when you visit that out-of-network provider, those new limits kick in. Okay? Once you bounce back to an in-network provider, the top set of limits kick in. So, for example, we just had a $30,000 claim, right? You paid $3,000. The fund paid $27,000. We incur another claim for $10,000. Hey Bryce, what's the deductible for out of network?
So the deductibles
Or
are
what's
the
the,
same.
what's the total?
Out of pocket max is 4,500 instead of 3,000.
Okay, so now you're gonna be on the hook for another $1,500. Cause you went out of network. Plan will pay the rest, but you're on the hook for the next $1,500 of that $10,000. So you kind of see how that works? It really is dependent on where you go. Now, as I sit here today, and as Bryce is standing, the good news, 98% of the hospitals, clinics, service providers that you already attend in the Fox Valley area are in the United Healthcare PPO network. That's awesome. It's a great percentage. What's the 2%? I can tell you a majority of them are going to be chiropractors. Chiropractors typically don't find themselves in a position where they feel the need to negotiate with a United Healthcare. They set their own rates, and I don't want to say they're outliers, but in their industry, that's not uncommon to be out of network. So for those of you who see chiropractors, that's fine. The plan still covers it. Just understand that the plan is going to pay less and you're going to have to pay a little more. Sir.
I thought there was coverage for chiropractic visits.
Yeah, you have a separate actual chiropractic benefit. It's listed on
Right.
your SBC, so you get 21 covered
percent.
covered chiropractic in the area.
Right. Sir.
So is that $3,000?
Excellent question. So the question just, for the video as well as for those here present. The gentleman asked, is that $3,000 come out of your dollar bank or how does that work? If you have sufficient amount of funds to cover that $3,000, yes, you can ask for a reimbursement from your dollar bank. So remember, you got to keep your floor, right? So we got a floor of $2,444. So if you are going to ask for a reimbursement from us, we want to make sure you have at least $5,444 in your dollar bank. At the end of the day, you have zero out of pocket because we have reimbursed you for whatever out of pocket that you had. That's how the trustees designed this plan, was to try to make it not only as seamless as possible, but put all of you in a position where that dollar bank serves as an avenue for you to get reimbursed and limit the amount of money that you have to pay out of pocket.
And in that example as well, sorry, but if you are applying for a dollar bank reimbursement, we reimburse out of dollar banks once a month.
Yeah.
So everybody knows, The form is on our website. We'll show you how to get there later, to download that. So, you know, if we maybe just issue the month's reimbursement and you turn it in, you might have to wait, you know, 3 or 4 weeks till you get the money. But in the example you're using, where this was a claim that was processed and paid by us to help fund, we don't even need you to send us any sort of proof that this was for a help, for a medical related expense, right? We know you paid this money out of pocket because we processed the claim. We're gonna be able to just take in the money. If there's ever a time where you're on the hook for something that wasn't processed by the fund, whether it's, you know, you paid more than the vision benefit is for glasses, or you're at Walgreens, you had to buy crutches or something, then you're gonna have to turn in a receipt for that when you ask for that money out of the dollar bank, just so we can verify, yes, this is a health related expense. You know, you were buying like a new set of tires or something, so.
Can I see a show of hands of how many members are married in the audience? Oh, so we have quite a few. If your spouse is working, if he or she has coverage through their employer, and if you are covered under your spouse's plan, we have what's known as coordination of benefits. Before I explain what that is anybody in the room 26 years of age or younger? And so we have quite a few of you. Would any of you happen to know if, because you are of that age or younger, would you happen to know if you're still covered under your parents' plan? Whether it's your mom or your dad. Okay, so I see at least 4 or 5 hands. 6 hands. I have good news for all of you. Coordination of benefits allows you the opportunity to do just that. So what do I mean? So let's go back to that $60,000 claim that was discounted down to 30. And you had to pay $3,000 out of your pocket, right? And I know this gentleman was willing to dip into his dollar bank in order to get reimbursed for that $3,000. But if you find yourself in one of those classifications where you're under your parents' plan, or you're also covered under your spouse's plan, we need to know that. Because from the fund office perspective, you as the member are primary under our fund. So we will process your claim first. That's how the law says it works. But if we are cognizant of the fact that you have coverage somewhere else, additional coverage somewhere else, it's then our responsibility to make sure that the information we processed and paid goes to that secondary payer. So whether it's your parents' insurance or whether it's your spouse's insurance, we forward that information on them. And then they look to see how much they will pay. In a majority of the cases, not all, but a majority of the cases, it's not uncommon where that $3,000 would ultimately be picked up by that secondary payer. So you wouldn't have to dip into your dollar bank to get reimbursed because the secondary payer would pick that up. So you want to make sure that the fund office has that information, because if we don't have that information, we don't know who to send it to. Sir. When you filled the form out, I think the union provides a packet, and you filled the form out, it would have asked for a secondary payer on that form. Good question. Otherwise, if you're not sure, contact our office, we'll tell you.
Dollar Bank, say it's sitting at $5,000, and you try to, for you send a receipt for your $3,000 out of pocket.
Mhm.
You guys kind of account for a portion of that to keep the board.
Excellent question. The gentleman asked, he's got $5,000 in his bank. And he incurred that $30,000 claim. He had $3,000 out of pocket. Would we end up just getting reimbursing him a portion of that $3,000 back? And the answer is yes. So we would end up reimbursing you, I know it's late, but I think it would be $2,556 is what we would end up cutting you a check for. Because we gotta make sure that $2,444 stays in your dollar bank.
And to complicate the answer a little bit further, let's say in that same scenario now, a few months down the road, you've been working more than is required and you've built up now the remainder of that money, we can retroactively reimburse you the rest. It's not like you
Excellent,
can never get that back.
excellent point.
Yeah.
We hold on to that information until you actually get to the point where we can reimburse you the balance.
So what happens if, your mother or father is already in local 400 working and one of his apprentices is now in the plant?
We coordinate with local 400.
So I mean, but for picking up that difference,
In that particular case, it's going to be dependent on the medical service that you had provided. I don't mean to dodge the question. But at the end of the day, that's what it's gonna come down to.
All right, so, go ahead, question.
So technically, you'd have to work 8.5 months to stay eligible before you can start, just a pocket. Is that what you're saying? That we keep that 2,400, whatever it is, that it's 282 per month, it's $1.
Oh, sorry, so that was in that example where you had 30 extra hours, that was just an example where you worked 30 hours before.
160 hours per month.
Then the short answer is yes.
Yeah.
You have to work 8.5 months. to Start pulling out the dollar to gratify the expenses.
Correct. Correct.
There's always a basement and a ceiling that you can't go below or above. One other quick insert here. A lot of the students, the younger members who come into the local, they have questions saying let's say they get married or they have a spouse, their husband or wife has good insurance or, they pay $400 a month for insurance to their wife. Can they get out of our insurance program? The answer is no. That is part of the benefits and part of the rough edges of being in a social endeavor like a, right? The only way to be ineligible for your insurance is not to be working. That doesn't include disability. So if you're working, that money's getting taken out and put into the fund for everybody. So there's no, okay, my wife or my husband has this, can I get out? That's a question that comes up quite often with the younger one.
That's a good point, Jason, and if you're in that situation, one thing I would like to point out is if you have a spouse working somewhere who doesn't have to take their insurance and maybe they're pulling money from your spouse's paycheck. You have two options, obviously, they can get off, you can have a little bit more take home pay, or you have to kind of weigh the benefit of coordinating our insurance with theirs. And honestly, I can't give you the answer on which is better, it depends on each your individual situation, but it is a choice to be aware of if you're in that situation where you have a spouse who could potentially not take their employer's insurance and bring a little bit more money.
Yeah, I mean, I can speak from experience on that one. My wife was in that boat. Her employer actually said, if you don't take the insurance, we're gonna pay you $250 a month. The insurance that we had was very good. I said, honey, take the money. So it exists out there.
How did we explain how far back you can go to get those claims out here?
So, yeah.
Good point. So if any of you were freshly into 2025, if as we go, I know it's happened earlier today, you might realize, I actually can reimburse for something that I paid out of pocket last year in 2024. We can go back to the beginning of 2024 and still reimburse you for all those claims. Yeah.
Where do you see those from that? How do you find out?
We'll go through that at the end we'll get you guys.
We're gonna get you all
hopefully logged
registered.
into the website, but the easier answer is, because the way it's gonna look on your portal is, it's a little bit complicated to understand. The best way to know exactly how much you have that it's available for reimbursement is to call our office, and Marissa's who you talk to, and she gets you the exact amount pretty much. Yeah,
So just for clarification, to go back to get reimbursed, it's just 1 calendar year.
And of course, it's dependent on you being eligible and you having a sufficient amount of money in your dollar bank to get reimbursed. Oh, excellent question. Her question was, if I'm going to be submitting reimbursement and I do multiple at the same time, absolutely. As a matter of fact, I would encourage you to do that. Why? Because there is a separate fee assessed for every reimbursement. So what I encourage members to do, if you can, because we have some local 400 members, they get reimbursed monthly. I guess I get it. But if you can hold off and get reimbursed quarterly or annually, it's much more cost effective to you. And you can, again, do 4 or 5, 10. We've had, I think Cheryl had one for like 15 or 16 reimbursements all at the same time. I mean, I've heard from members saying they keep them in a shoebox and at the end of the year, they submit them all and they're only charged once. That's awesome. So if you can do that, that's the way to do it.
any other questions on that before we move on? Yep.
Excellent question. The gentleman asked, would we ever go to a debit card system or what's commonly known as a Benny card system? The trustees have looked at it. Again, I've been working with your fund since 2001. We've looked at it at least 4 times. And every time, it was cheaper to do it through Benesis than it was a Benny card. I blame myself. Should probably charge more. But if we charge more, you probably get a benefit card. Sorry on video, but that's the gist of it. So it's much cheaper to do it directly through us. And again, because we do monthly reimbursements, the thought process is, if you're gonna put it on a credit card anyway, you're not gonna get that credit card bill for at least another, 20 to 28 days. You'll have the money from us by then. So.
Any other questions? All right, this next packet, honestly, a lot of you probably got in the mail about a month or 2 ago. But it's your 2025 summary of benefits and coverage or FBC. You're gonna get one of these sent out with your open enrollment packet every single year. I should be getting those between Thanksgiving and Christmas. And, a lot of you may have just tossed it out when we sent it a few months ago. I understand. But be on the lookout for that because it's gonna have changes in your plan. We're gonna go through the dental options in a second. If you're looking to make any sort of a change there, if you're eligible to change dental plans, that's the time to do it. As well as, to maybe need to change a beneficiary or something. If you guys are getting married, having kids, that kind of thing. You do have, and this is a bit of a morbid topic. I hope nobody in here has to use it for a long, long time. But this health fund does have a death benefit in the event, you were to pass away. So we do need to have a beneficiary on file. And I know we'll talk more about beneficiaries next week. We talk about their retirement plans, but it is something that you need to pay attention to for the health fund as well. You're gonna get this summary of benefits. Again, every year, typically not a whole lot changes. But it's gonna be just a lot more detail about some of the stuff we've gone over. I know we already talked about this first line item here, but we did mention some of these services that are covered before you meet your deductible. I know I mentioned that there are some. Probably the most common one we see is preventative care. So even if you've not spent a dime towards your medical expenses this year, the plan will cover, for example, a physical at 100% before you even if you haven't hit your deductible. It's considered preventative care. Some of the other things, I know not finding a lot of people in here are utilizing the hearing aid benefit yet. But you do have one of those as well. As well as glasses. Your vision benefit for glasses and contacts is every 2 years, you get a $300 benefit for the hardware, whether that's, frames, or contact lenses. You also have a benefit for vision exam, and that is every single year, you get one vision exam covered at a $25 copay. So whatever your eye doctor charges, the plan covers it all. You just have to pay $25 as a copay. You can do that annually. Obviously, if you have dependents, that goes for you and all your dependents. Everybody can get a vision.
This is a quick question, a personal question, and my wife and I were talking about this. If you got, would it cover prescription sunglasses?
If they are prescribed, yes,
They would.
yes.
Yeah.
But it would count again, you
You just get the 300.
yeah, you got those and you got normal glasses.
My wife would actually ask me, she had a good set, she's like, maybe I'll get a pair, and I said, thanks.
Yeah, I mean, yeah, it's a good question. And let's say if those prescription sunglasses were $500, you would have to obviously pay $200, but the difference, and you could get that reimbursed from your dollar bank if you had, enough money in there.
If I could jump back to the life insurance and the beneficiary, I know there were a number of hands raised saying that there were some married members in the audience tonight. It's important to note that because you live in the state of Wisconsin, domiciled in Wisconsin, by law, your wife is your beneficiary. So, as you fill out that form, keep that in mind.
One real quick thing before we get too far down the line, there is a caveat that comes into effect with how much your plan costs you per month. How many people in here get their yearly physical? Okay, and does everybody in here understand that if you do not, it's gonna cost you $50 a month? Correct? And if it's your spouse with you, that's $100 a month, right? So make sure you get your physical.
Yeah, that's a good point too. I know we'll go into the wellness stand here in a little bit. If there's anybody in here who may have done it last year, but everybody in here is gonna have to do the wellness stand this year. We'll go through it here in a few slides, but I want to skip forward a little bit in this package, just a couple quick things I want to touch on. You also have a prescription drug manager that is currently ESI. So if any of you guys are taking prescription drugs, you should have had a packet from ESI. Or otherwise known as Express Scripts when you became eligible. If you don't have that, reach out to us so we can get you their information. And there's a little bit of information on this SBC, but I wanted you to at least know that is, if you see ESI or Express Scripts, they're managing your prescription drugs.
And by the way, all this information is on your insurance card, your health insurance card, so.
Second to last page of this, wanted to cover a few things that the plan does not cover. And then there's, I guess, some caveats as well. So this top box, talking about things not covered, and there are, some interesting examples, but the second one here you see cosmetic surgery. So one of the examples I always use is something, if you want a nose job, right? That's probably going to be considered cosmetic surgery, but it could be that maybe your doctor actually prescribed it because you suffer from, maybe severe sleep apnea, and clearing something out in there is going to fix that, that medical issue for you. That could be something that the plan would then cover. If you're in that situation and it's still coming back and denied, that's one of those situations you could possibly appeal to the trustees and have them at least hear your situation and make a decision. So just so you guys know the way it works, if you were to submit a claim for something like this, that is not covered by the plan, and it happens all the time, UHC typically would deny the claim, and it may come back to our office. We don't sit there and make the determination that this should be covered or it doesn't. What your fund uses, it's called MRIOA, the Medical Review Institute of America. It's a third-party medical review company. We send that to them, they know your plan rules, and they make a independent determination on, yes, this should be covered by the plan, no, it should not. In the case that it comes back as no, that is when you could, potentially go to the Board of Trustees, appeal that decision, and see what happens. Again, worse, they can say, no, you're in the same boat that you were before. So, something to always keep in mind. one thing that isn't covered up here, and I know Jason, you've asked about this before. If you guys are ever traveling outside the US, any non-emergency care is not gonna be covered. Now, we should have mentioned this before, actually, when we were talking about in and out of network, but no matter where you are, if you have an emergency, and you mentioned too, if you're traveling for work, whether you're traveling for work or on vacation, you have an emergency, let's say you're down in North Carolina. Don't try to call our office or call UHC to figure out if the nearest emergency room is in network. Go to the first place you can find. Everything that is, every cost incurred will be covered at the in-network level of benefits for an emergency. And that goes for anywhere in the world. So if you're in Mexico, you have something really serious happens, you have to go to the emergency room. This plan will pay for that. If you're in Mexico and you go to a doctor because you got a sore throat, that's obviously not an emergency. Plan isn't gonna cover it. Last page here just goes through a couple more examples on how different claims they can cover depending on your situation. And now we get to the dental options. We'll take a break, I think, after we go through the dental plans. Does that work? Okay. Okay. Who in here is in one of the dental plans? Got at least a few? Okay. In your fund, the dental coverage is an optional benefit. But it is a benefit that you have to, quote unquote, pay for, typically by the hours you work each month. Now, if you look at these two choices, and Jim and I are gonna have some words of caution, but, there's Care Plus and there's Delta Dental. Those are your two choices. Again, you don't have to take either if you don't want to. But if you look at the comparison here, obviously the Care Plus plan, seemingly line by line, is either slightly better or significantly better than the Delta Dental plan. It also is a little bit less per month, $84 compared to $93. Again, if you take this $93 for Delta Dental, $9.40 is your $9.40 an hour is your contribution rate. It's very close to just an extra 10 hours a month to get Delta Dental. So take 130, basically make it 140, and then a little bit under that for Care Plus. If you would like to choose the Care Plus plan, which again has great benefits, and there's a reason we included a lot of their locations here in the back of this packet, but they have at times not been able to see either new patients or they can't see for maybe 9-10 months to get your teeth cleaned. The reason is they are a very small network compared to Delta Dental, which is pretty much any dentist. I won't say every dentist, but most dentists you run into, at least in the state of Wisconsin, except Delta Dental, they're part of their network. Care Plus is much more condensed. There's only so many locations, and we have had, instances where somebody's in the Care Plus plan, they call to try to schedule a teeth cleaning or maybe their kids need some dental work done. And Care Plus either says, yeah, we can get you in 9 months, or we're not taking new clients at this time, sorry. So if you're gonna make an election and get into one of the dental plans and you wanna get into Care Plus, I would just advise you strongly to call them first and find a location that can take you, make sure you can get on their books, whether it's for you or you and your dependents as well, and then make that election. And the reason I caution that is because, once you make an election in one of these dental plans, it's 2 full calendar years before you can change that. So right now we just started 2025. If you were to enter a plan now, it's actually all 25, all 26, and all 27 before you can make a change. Because 25 were after January 1st, so this would not count as a full calendar year. There are some caveats to that. If you do choose Care Plus, when you're in Care Plus, and you absolutely cannot get an appointment, we can work with you to, so you don't have to wait 2 or 3 years. But are there any questions on the dental, the rest of this packet? This has an enrollment form, and then just some of the locations I talked about earlier. Take a break. We want to go to
Yeah, all right, let's, 10, 12 minutes, max 12 minutes, be back in here and, correct this stuff.
Probably that's to be.
Yeah. Yeah.
What's that? Are you ready, boss? Contact. All right, we're gonna go back into it. Before we start back on the paperwork, there was a question asked at the break. You know, what are possible expenses, reimbursable expenses from your dollar bank? And Bryce has brought up, a link on our website, that basically illustrates, what those possible reimbursements might be. If I'm not mistaken, it's 42 pages long. So there's quite a few that are out there, and as Bryce scrolls through, you're gonna see some of these, slow down a little bit. You know, for example, babysitting and children, it'll tell you it's not a qualifying expense. So don't try to get reimbursed for that. If it has the yellow triangle with the black exclamation point in it, it might qualify. So it depends on the specific set of circumstances. If it has the green bullet, it means it's a go. Yes, that would qualify. So birth control pills obviously is a qualifying expense that you can get reimbursed from your dollar bank.
Hey, everybody, let's listen up, please.
Blood pressure monitoring devices, for example, is a qualifying expense. So as you scroll through this, like I said, it's 42 pages long. So if you're inquiring as to, hey, is this going to be a reimbursable expense? This is going to be the link that you're going to go to find out whether or not it qualifies. And you can see it's in alphabetical order.
And it changes all the time. I think it's set on top. This was last updated 2 weeks ago.
I was gonna say, it's updated rather frequently.
Yeah.
So I want to say it's at least once a month where they will update this listing. And again, it's a link, so you can be directed right to it. So, obviously, we're not going to go through all 42 pages, but we wanted you to understand that, you know, there are some things that are clearly not reimbursable. There are some things that are maybe, and then there are others that are clearly a reimbursable expense, so.
All right, so we get back into the packet, guys. The next thing we're gonna talk about is, something that's relatively new to your fund, in the last 3-ish years, I believe, predating me, but, Prevea Partnered Health, you guys have actually I call it a dedicated clinic in Grand Chute that is only for local 400 members, as well as 2 other employers, I believe, can utilize that clinic. And again, that clinic is through Prevea. A lot of the things listed up here, that clinic does, actually, most of the things up here, that clinic does, but I wanna point out before we really dive into how the arrangement works, is that if you don't live close to that clinic, because I know obviously you guys are coming from a pretty wide geographic area. This Prevea deal includes more than just the one dedicated clinic for you guys. You actually have, a list here. I think there's close to 30 or even maybe more clinics, most around this area of the state, but there's also some out west, that you guys can utilize through this arrangement your fund has. How does the arrangement work? From your perspective, you can use Prevea, any of these clinics, for any of the reasons listed on this page, and it's at zero cost to you. And this would again fall into that category of things that are covered by the fund before you've met your deductible. So if you haven't spent any money and you're going to Prevea, it's still $0 out of your pocket for these expenses. If you're going for something that's over and above anything you see listed here, it's gonna be treated like a normal health plan, just so you know, and you may have to pay some out-of-pocket money. Why did your fund a few years ago decide to go for this arrangement, and why aren't they passing any of the costs along to you? Jim, you were here for that, so I think I'll let you.
Yeah, so thanks, Bryce. So, well, probably 8 or 10 years ago, the trustees found themselves in a position where they wanted to obviously try to reduce cost, but at the same time, you know, keep a very good level of services as it relates to medical, dental, and vision. And so they pursued a number of different options. And for those of you who've been around for a while, you may recall there was a point in time where we actually had our sights set on actually having our own dedicated clinic, not too far from the Grand Chute Prevea Clinic. And the trustees at the end of the day elected not to pursue that. And the reason being is because programs like Prevea were on the horizon and provided us with an opportunity that gave us just as much flexibility and autonomy as a dedicated clinic would be. So what do I mean by that? Well, if we would have gone the other route, that clinic would have been just ours. It would have been only for local 400 members and their families. It would have only been located in Appleton. There would not have been other locations. So if you lived in Green Bay or Oconomo or Fond du Lac or anywhere else in the Fox Valley area, you would have had a pretty nice car ride to get to that clinic. So at the end of the day, the trustees looked at all of that and the cost associated with having their own clinic and having to pay for their own, you know, beds in the clinic and all the equipment and actually having to hire nurses and all that kind of good stuff. When the Prevea arrangement came to light, they put the halt on the dedicated clinic and decided to go down this road. This particular clinic, although it's not just dedicated to local 400 members, did provide that flexibility to have a number of other clinics, and Bryce has already pointed those out to you. So now if you live in Green Bay or Oconomo or Fond du Lac or wherever you may live, there's more than likely a purveyor that's much closer to you than the Appleton Grand Chute clinic would be. It's also an arrangement in that one of the trustees was concerns were, if we have one clinic in just in Appleton, what kind of participation were we gonna have? How many people from Green Bay were we gonna see? How many people from Oconto were we gonna see? How many people from Fond du Lac were we actually gonna see? Because of the travel and the length of time to get there. So they knew that there wasn't going to be as good a participation unless they had something like Prevea, which offered a number of clinics to participate in. So we move forward with that. So the one nice thing about this is we're not paying for something that we're not using. So from the fund's perspective, if you decide to go to Prevea Clinic, which we encourage you to do so for even the simple reason of not having to pay out of pocket, the fund actually picks up that cost. Now, the arrangement we have with Prevea is a in-network UHC provider already. And we said, well, we'd like to strike a deal with you, but we already have United Healthcare. You're already in the United Healthcare network. Give us some numbers that are actually going to make it more attractive to us to sign with you. I mean, that's how deals work. That's how you strike them. And so they came back, and the long and short of it is, right now, the fund is being charged about half of what we would normally charge if we just went through the UHC discount through Prevea. That's what kind of deal they're giving us. So in the long run, we're saving money. We're only paying half of what we would have normally paid had we not had this arrangement in place. And we've expanded the scope of the number of clinics that you can participate in. So it was really a win-win. I always tell members, you're the fund. So this benefited you, the fund, and it also benefited you as the member, because now when you go to those clinics, you're not paying anything out of pocket. It is critical to know when you become eligible in the plan, you're going to get 2 cards. You're going to get a white card. It's going to have UHC in the upper right-hand corner. Left side, it's going to say Local 400 Health and Welfare Fund. You're also going to get a blue card. That blue card is your Prevea card. Prevea has everybody's names and addresses already. We actually provide them with that feed every month. Okay? When you show them that blue card, they then know not to charge you and that your visit is free. If by chance you use the white card and accidents happen, and you go to a Prevea clinic, we catch it at the fund office. We then go back to Prevea, and we go back to the arrangement that we have with Prevea, and they correct the payment that we have to make to them. So please use the blue card as you go to these Prevea clinics. Why go to the Prevea clinic, right? How many people here in the room already have a primary care physician? How many? Okay. Here's a perfect reason to get a primary care physician. Doesn't cost you anything. Okay, so your visit with that PCP provides you with the opportunity to build a relationship with one of, we have 2 doctors, if I'm not
Yeah,
mistaken.
Dr. Fry and Dr. Tumulty, British flag.
Okay, so we have 2 doctors that work with us specifically. And you can build that relationship and have one of them serve as your primary care physician. That's important in the world we live in today from a medical community standpoint, because as you need to seek other treatment, you're going to find that no matter what other treatment you're seeking out, they're always going to come back to you and say, who should we send this information to? And that's supposed to be your primary care physician. Okay, so if you establish that relationship now, you've already crossed that hurdle. And as you need additional medical care, that all gets funneled back to your PCP, who assists you in your ongoing health. So it's a great program. It's far exceeded our expectations, to be honest with you. The fund is saving even more money, and at the same time, it's giving you that one-on-one, I always call it the warm and fuzzy feeling, knowing that this particular group is dedicating themselves to Local 400 and a couple of other single employers.
Couple last things to point out too about the Prevea rate, guys, is obviously the primary care and, like as Jim mentioned, your PCP is probably the biggest, use, I'd say, but they also do, physical therapy and occupational therapy, which I know is a big demand, especially if you guys are ever, finding yourself maybe a little sore about something, you can go to Prevea. It's totally free. I know we already mentioned you have a chiropractic benefit as well, 21 chiropractic visits a year. So, between the 2 of those, you can really get a lot of pain management done, I would say, for very low or no cost to you. And then the Spot Box, they actually have urgent care services as well. Important to note, not emergency care services. So if you're gushing blood go to an emergency room. But for these urgent care things, and you can see, not a comprehensive list, but, a fairly decent list there that they can see for Prevea. They're not a walk-in clinic. I know they want us to say they are not a walk-in clinic. Please try to make an appointment. A lot of times they're gonna be able to see it right away, same day. But as Jim will say, if you do walk in, they're probably not gonna turn you away. They'll see you. This, one thing I want to point out, this list of, locations, if you look at all the X's in the right-hand column, not every location does everything. So you'll see, not all of them have, urgent care or yada yada down the list. So if you're gonna go to one of these other locations, make sure you pay attention to what they do or don't have that spot. Again, they are in network, even if they weren't part of the special arrangement. So let's say you're at Prevea for something, maybe you are trying to develop a relationship with a primary care physician, and they see something that they have to refer you above and beyond this Prevea arrangement. Again, they know your plan, they know your local 400 member, they're going to refer you someplace in network to get whatever that bonus procedure is or whatever that may be. So just, rest easy knowing that. And if you're ever in a situation where you have to get something done and you're not sure who's in or who's out of network, again, that's something you can always call our office for. You also have a tool on the website you can utilize in those situations. We'll go through that at the end. All right. A lot of you guys probably got this next sheet of paper in the mail. Oh, do we got one?
Nope.
Yep, sorry.
Where can we get the cards?
Blue cards.
Right here.
There you go. Does anybody else not have one? I guess. Make sure you
Grab one from Jason on the way out.
make sure you grab them before you leave. If you're not eligible yet, just so you know, don't use it until you're eligible.
Yeah.
Because it won't show up.
Bill.
Right.
Jason, are those the hard ones?
Okay, so this benefit bulletin, this went out a week or so ago. Some of you may have got it or maybe getting it soon. If you're eligible, you're gonna get one of these every quarter. And the one constant that's always gonna be in benefit bulletins is what we're gonna talk about now, and that's the wellness program. So show of hands, how many of you in here did your wellness program last year, 2024? Okay, actually, quite a few. There we go. For those of you who did not, it may be you weren't eligible yet and you didn't have to, or you may have some bad news coming when we go through the sick penalty. We'll see. But now that it's 2025, everybody that is in this room will have to participate in the wellness program. You're actually in wellness year 12 already. And what does the wellness program mean? It's whether you want to call it a PHA for personal health assessment, a biometric screening. It's a wellness check, if you will. We have plenty of them here at the hall. There's also a list of, again, on this benefit bulletin, there's a few hotels that will host them throughout the year. I know some of the bigger contractors actually will have on-site screening events. You can go in and sign up for whatever day works for you. You go in, I think Jim will tell you, you're in and out in usually about 15 minutes. They measure a few of your vitals. They do prick your finger. So it's not a full blood draw if anyone's afraid of needles. It's just a finger prick. And then you're gonna likely have to do some coaching afterwards as well. You have to go through the coaching with a company called CMSI in order to get credit for doing your yearly screening. And if you fail to do that, you'll see there it's actually listed in this bulletin. But you're gonna pay a penalty for a year. So to give you a timeline, now that we're in 2025, you have until the very end of this year to do your wellness check. Let's say you do it at the very end of the year, we actually do extend, if you don't get the coaching portion of it done in 2025, you have until the end of March of 26 to get that done. I would say, try to just get it done earlier, so you're not pushing that towards the very end of the year. If you fail to do it in 2025, starting in June of 2026, you are gonna have a $50 a month penalty pull out of your member dollar bank, and that's gonna last for a year. So it's $50 a month for a year. If you are married and your spouse, so if you're married, your spouse also has to participate in this program. It's a requirement for both of you. Kids are exempt, they don't have to do it. But if you're married and you and your spouse both fail to participate, that sick penalty actually doubles. So it becomes $100 a month, every month for a year. So it can be a pretty steep penalty out of your dollar. That's $1,200. And one way to think of it is if you both don't do it, that's $100 a month. Right now, that's about 11 hours you have to work every month just to cover that penalty for not doing your 15-minute wellness check in the prior year. If you're not sure if you did it, so if we're getting towards the end of this year, you're like, shoot, I can't remember if I did it. Was that in 25 or was I doing it in 24? Call our office, we'll look and see if you're good for the year or if you have to, to still do it for the current year. And this will likely be a requirement for you every year. So I know a lot of people like to get on the schedule, whether it's I do it every April or I do it every September. But it makes it easier to do it that way. And we'll always have a reminder in these benefit books.
But still able to get a physical?
Yes. So that's a good point. I mentioned the events. Again, a lot of them are held here at the hall. The other option is to go to, say, your own primary care physician. If you go that route, you want to go get a physical, you can absolutely do that. But what you have to do first is go on our website and download the wellness forms or have us send them to you and bring them to your physician, because your physician might do a full physical and it doesn't check all the boxes that this wellness program requires. So it's not going to count for the wellness program. But if you bring the proper paperwork, they're going to see, okay, I have to make sure I do this and this and this, and they're going to hit all those boxes. And then you just have to make sure they send that to our office,
That's key.
or you send it to our office. So we have a record
The latter.
of you doing it, correct?
Yeah, Bryce brings up a good point. Please don't put the onus on the doctor to get it back to us, because I can't tell you how many times people have said, well, my doctor did the physical, you don't have the form yet. And we're like, yeah, we don't. So, 9 times out of 10, the doctor's gonna fill it out right when he's done with your physical. And then you can just take it from the doctor and then send it on to us. That way there's nothing falling through the cracks.
I might be jumping ahead, but why do we do this? Why do we do that?
Yeah, no, good question. Obviously Bryce said we've been doing this now. This is our 12th year. So about 15 years ago, the trustees, I think I alluded to earlier, the trustees are always looking for ways to try to, make the health fund as cost effective as possible. It's an uphill battle. There's no doubt about it. I mean, medical inflation is still hovering in the high single digits. Prescription drug inflation is still at about 10 to 12%, which is staggering. So it's a battle, to say the least. So, I'm proud of the fact that over the course of the last probably 5 to 10 years, you guys have really not had to put much into your health fund. There are times, when you do your allocations in May, you'll put in a nickel or a dime and the health fund hasn't asked for anything. So again, I want to paint the picture. Your trustees are always looking for ways to make this a very cost-effective, successful program. So about 15 years ago, the trustees that were in place at that time said, what else can we do to, do just that? And, the single employer community had already started this process of wellness programs. And if you look at a dollar within your health fund, that dollar contribution, 94 cents, 94 cents of that dollar actually goes to pay benefits. The other 6 are administrative costs, our fee, attorney's fees, legal fees, or consulting fees, investment consulting fees, so on and so forth. So the bulk of the money, obviously 95% of the money is going to pay claims where it's medical, dental, and vision. So we said, well, you need to address the big item, which is medical. And what single employers were doing back then, and are still doing today, is saying, we want to nip this in the bud. We want to try to know ahead of time if someone may have some medical condition that they're not aware of. And hence the program started. So we started this off as kind of a pilot program. The first 3 years, if I'm not mistaken, we actually offered gift cards. Where if I'm not mistaken, it was $75 to show up and have the test. And if you had the test, we gave you another card for, if you passed, we gave you another card for $225. So you got $300 in total. I actually participated in the program in the sense that I visited every event and kind of monitored every event for the first 2 years. And during the 2 years, United Healthcare was the service provider who actually conducted the actual screenings. Right now, the health fund employs us directly to do it. And over the course of those first 2 years, we had 10 people of what United Healthcare called white sheeted. And what that meant to us, in layman's terms, was their numbers were so bad, they needed to seek immediate medical attention. In every single one of those 10 cases, none of those gentlemen realized they had anything going wrong. None of the 10. The story I always tell is we were in our second year, we were at team hosted an event for us. A member came in, he was probably in his middle 40s, came in with his wife and his 10-year-old daughter. Mom went into one booth, dad went into the other. The daughter stood up by me at the registration table. She was conveying to me how afterwards they were going to go to the Dells with the gift cards that they got. And I thought that was really cute. And mom came out 15 minutes later. She had passed, and I gave her her second gift card. Dad was still in the booth. And still in the booth. And 25, 30 minutes later, still in the booth. And the nurse came out to me and she said, call an ambulance. This guy has to go right to the hospital. His blood pressure was so high, it was registering extremely high on their mechanism. So we called the ambulance, they took him to the hospital, and then they said he was a ticking time bomb. That he was actually at the point, unbeknownst to him, that if he kept going the way he was going, he wasn't going to be with us. He was in the hospital for a couple of days. They put him on medication to treat him. Until this day, I don't hesitate at least once or twice a year to look on the system and see if he's still with us. He still is. So that's why we did it. It provided us with the opportunity to find the unknown, not just from the health fund's perspective to try to save money, but or in this case, it was this gentleman's case of being able to stay alive and watch his daughter grow up. So that's why we do it, gang. You know, I always share with, because it's always startling when people hear it. Does anybody have any idea today what a stroke or a cardiac arrest cost today? Anybody have any idea? Heart attack. Anybody want to venture a guess? Because we see these claims pass our desk, unfortunately, more often than we want to. Discounted, not the full price, but the discounted price is about $500,000. Okay, that's a lot of money. That's a lot of employee contributions, right? And the fund doesn't want to pay that if we know that we can nip this in the bud ahead of time. Can we solve every problem? No, we can't. But there are some things that we can be proactive at, take the initiative to at least curb those kind of costs, if we can. That's why the program's been around for 12 years. We still find people till this day that they had no idea, no clue they had high blood pressure, no clue they had high cholesterol. So when they see our nurses and they go through the testing and go through the coaching, they're directed to the appropriate medical provider to make sure that those those concerns are addressed and that we get them on the proper medications that they need. So they stay with us, for a longer period of time. So, Rob, I don't know if that answers your question, but that's why we did what we did. By the way, we did away with the gift cards, and it was your brothers and sisters, about 7 years ago, 8 years ago, at a union meeting that told me, or asked me, Jim, how much does it cost for you guys to give us these gift cards? And I said, it's 25 cents an hour. That's what it costs to give you guys these gift cards for attending these events. And almost unanimously, they said, stop. Keep the 25 cents, put it back in the fund and stop the gift cards. So we did. So for the last 7 years, we stopped the gift cards, but we continued to stay. And it's to encourage you to get this done. Doesn't take long. And if you can spare 15 minutes a year, it's well worth it for both you and the fund.
Also, one quick, tidbit of information. If you choose to go through the wellness program, obviously that does not cost you anything out of pocket, nor does your yearly physical, right? That costs you nothing. So you're not gonna be charged part of your deductible, none of that. So just to let you know, it's a deterrent, it's essentially free. I mean, it's costing us all, but it's not gonna cost you either. Good one.
Any questions on the wellness program before we move on, guys? Got one? Good question. I would say almost everybody does the coaching via the phone. So there is a chance that you won't have to do the coaching if all your numbers are, fall within the acceptable parameters. I will say, it feels like they always find a reason, to fail you. It's one of those things.
It's about 70% right now that fail.
So how it works from a member who has to go through that, I'm sure
He's one of them.
my other brothers were up here through it as well. You're gonna be set up, somebody will contact you, all right, and they will say, is this a good time, blah, blah, blah. They're gonna ask you questions, what do you do, what do you exercise, or what are you eating, blah, blah, blah. About 10, 12 minutes, it's not too long, nothing invasive. Then they're gonna ask you what is a good time for them to call you back, and they're gonna ask you such things as, what are your goals? Are you working towards losing weight? Are you eating better? Also, you will, how often we get the help and, the recipes and they'll send you stuff in the mail.
Oh, yeah.
That's about it. You'll go through, I think it's about 4 of them.
Yeah.
There's 4 of them.
It's up to 4, Jason, depending on.
Depending on how. But it's just basically, are you quit chewing, still eating mayonnaise, hamburgers, all this, it's suffering.
They're-
The basic coaching, get you to think, they'll help you, encourage you, they help you with your problems. And what's the number one problem most of us deal with? Right, but as we get older, it's usually weight that gets us all, blood pressure, so it's a lot of stuff like that. Does that help answer? Yeah, so it's on the telephone, they do it under your schedule, you will tell them when to call.
Yeah.
And you should be expected to answer. If they don't, they leave you a message as well as they leave you their personal telephone number. Get a hold of them, to coordinate this. So, and if you don't answer, don't do it. Once again, you're not complying as.
See, they'll tell us and then you're non-compliant, so the stick gets applied.
Any other questions before we move on?
If I could just, once you finish the coaching, like I said, it's up to 4, then you're good. You're good till the next year. So it's not like this is an ongoing, constant calling arrangement. But obviously they're encouraging you to try to get you on the right track. Yeah, good question. She says, is it pretty much, you gotta do all 4 and you're good? It is really dependent on what you failed, to be quite honest. It's not uncommon, for example, where a member will come in and say, I know I have high blood pressure, I'm gonna test for high blood pressure, but I'm on medication. They'll tell the nurse that right from the onset. That all gets noted. That also gets passed on to CMS. So CMS knows, hey, we don't have to get you to a doctor and get you on medication. You're already there. So the question, you may have two sessions. And the first session is, do you find that the medication is helping? Is it reducing your blood pressure? They may encourage you to get your own at-home kit, so you can take your own blood pressure, once every 3 days or something. That's the kind of dialogue you'll have with them. Because they just want to make sure you're on the right track and that you're receiving the appropriate type of medical services that you need.
I just got one thing, can you kind of explain we're basically doing the health assessment and all that for the following year's charges?
Yeah, so that's
Try
that,
to explain that.
that's that leg I, briefly mentioned. So we're in 2025 right now. Well, actually, it's probably easier to go back. So if you didn't do it in 24, which we're already out of, that stick is gonna hit in June of this year. So it doesn't hit for, 6 months after the year, and then you can't do anything about that until next May. The only way you can get it to stop is by doing your wellness, program this year, and then it'll stop. Starting next year.
Charged the year after.
Yeah,
Right. 6 months after the calendar year.
right. And before we move on, if everybody just save this bulletin, because we're gonna come back to it when we go to the website. It's got the actual website address listed on here, so we'll put that off to the side. That'll help us at that point, but I wanna mention, you guys have, it's called an EAP, or Employer Assistance Program. It's through Ascension. Their number is on the bottom of this flyer. And I know when a lot of people think about an EAP, what right away comes to mind is if you're typically struggling with addiction, alcoholism, depression, anxiety. Those are probably the 4 things that people think, boy, this is what my EAP is here to help with. And also, I didn't mention this under the Prevea section, they do have, mental health providers at Prevea, so if that's something you're struggling with, that's something you can get help with at Prevea, or you have the CAP resource. I wanna stress a few things. Number one is that there's actually a lot more the CAP can help you with, other than just the things you think of. You'll see there's, family conflicts, you're having trouble in your marriage. Even if you're stressed about doing your taxes, like they can help you find an accountant or CPA, or any other financial troubles. I know that's, finances are a big driver of stress today for a lot of people. This is something you can use the EAP for. The other big thing I want to point out is the EAP is 100% anonymous. So if you use this, Jim or I are never going to know. Your employer's never going to know. It's something that's also available to your dependents, obviously. So if your spouse or your kids are going through something, you can use this as a resource for them. I would say too, if somebody you're close to is going through it or having a hard time and it's kind of wearing off on you, or you don't know how to help them, you can call the EAP and just, have somebody to talk to about that, and maybe try to find some resources to help somebody else. And again, totally anonymous. Your employer, Jim or I, won't know, your trustees won't know. The only thing we get from Ascension is, a quarterly report showing basically how many people call. So your name is never gonna be associated, but something to please keep in mind, again, if it's ever something you need. All right, we're getting close to the end. We're gonna actually skip through for a second this MedExpert packet. And I wanna go to what I believe is the last packet, the Live Health Online. So this is another added program you guys have. It's essentially a teledoc, used for a lot of these, reasons you see listed on the bottom. Obviously, if you're having an emergency, the teledoctor is not going to do you a whole lot of good. But for some of this stuff like colds, flu, if you wake up, you got pink eye, or there's something in your throat, maybe you think you got strep. A lot of times we hear members use it if it's like, it's 1 a.m. and maybe you got a kid and they're feeling sick. Tomorrow's a school day. try Live Health Online. It's free. It's 24/7 service. You can get a doctor to essentially do a video chat with you, and a lot of times they can diagnose something. I know the example we typically hear is, hey, they diagnosed my daughter with pink eye, prescribed some drugs to the Walgreens down the street. I went and picked it up at 2 a.m, as opposed to having to either go to urgent care in the middle of the night or, just waiting until the next day and prolonging getting care. So again, it's a free service to you if you're in that situation, and it's, again, not something super serious where you have to rush to a hospital. It's a benefit you do have available. What I want to be very clear on, if you go to this page 2, you'll see that the 10-step process. It is a bit complicated to get signed up and logged into this, at least the first time you use it. You really have to follow this 10-step, like step by step in order to get all the way in. And also to not have to pay. You'll see step 10, it's initially going to show you a fee of $59 when you're going through the checkout. There's a coupon code, which is also listed on the bottom, LOC 400HF. You put that in there, it's going to wipe off that $59 and make it free for you. Again, I've never used it, but my understanding is once you've used it once and you're past kind of the whole create an account stage, it's a lot more streamlined. So.
And we actually have, as I approve the invoices as they come through, the fund ends up paying the $59. We average about 4 local 400 members and or their dependents a month. So, for the most part, it is getting used. What I've heard is members find most advantageous, and Bryce alluded to this, is the off hours. It's Sunday night when your kid has an earache. Do you really want to go to the emergency room? Because that's the only place you're going to go, right? On a Sunday night. So you log in, they hook you up with a doctor. That doctor's going to ask you to put the phone camera to your daughter's ear, look in the ear, and they're going to end up prescribing something. They're going to ask you where the local pharmacy is that you'd like the prescription sent to, and off you go. So members who use it, that I hear from, absolutely love it because it's so convenient, especially in this kind of weather.
Good point. All right, guys, last thing we're gonna go through tonight is I want everybody, we're gonna take a quick spin through the website, and I want to try to get everybody signed in to Member XG. And that may take a little bit. So I told you to save that benefit bulletin. What you're gonna do is into your search bar on your phone, because I know hopefully we all got phones. Type in that website. It's on the back page of that bulletin at ps400benefits.com. And that's going to redirect you to the website you see in front of you. So I'll give you at least all a minute to get there. It's going to redirect you to this bpalja.com. Just don't be confused. Our benefits used to be bpalja. That's why you're seeing that, just so you know.
We're still BPA, we're a business.
Very true, very true.
Get it right. That's a soft spot in my heart.
All right, is anybody not at least at this stage yet?
Yep. I see a lot of that.
It's like we're getting there? Okay. So this is actually where you're gonna find all 3 funds. So obviously the health fund we talked about, and then the other 2 Jim and I are gonna talk about next week. So you'll see they're listed here as the profit sharing, the pension, and then the health fund. If you look at all the different sections you have under the health fund, to your earlier question, sir, if you want to go to your own doctor and get a physical for your wellness exam, this is where you're going to download those forms. So you'll see wellness forms 2025. You print those off, take them to your doctor, have them filled out, and then return them to us. If you are trying to schedule your yearly wellness exam, there's a calendar here for you that will at least have all the on-site events. So I think the next ones are maybe in.
I thought you said March.
I saw them earlier. Now they're not popping up. they'll pop up here on the calendar, whatever the open dates are. There it is. So you'll see March here, if you wanna sign up for these events. It'll show you how many slots are available. Click here, put in your information or your spouse's information, again, whoever's doing it.
Remember you see all the different contractors on there, sort of multiple areas to do.
Right. Contact emails for our office are here. If you're looking for any of the documents, so your SPD should be on here under one of these. One of these links, summary plan description, actually the very bottom one. Your summary plan description, which you all should have got when you first became a member, that's the really long book that really is like every rule for the fund. It's the governing document. It's gonna be restated soon.
And it changes.
Not being sarcastic. And your health fund is probably the most fluid document out of all your documents, because the trustees are always looking at different things, always adding different things. So don't be surprised if, as soon as that SPD comes out, it's gonna be updated.
Is everybody on this page now? I think we're good. All right. So the most important thing I want us to get out of tonight is I want you to sign up, if you're not signed up yet, for it's called Member XG, and that is your health fund portal. So all the stuff we talked about, claims, your member dollar bank, your eligibility, your how many hours you're working a month, that's all gonna show up here. And it's a great tool for you guys. So go to Member XG. Chances are you haven't made an account yet. So you're gonna have to go down here where it says log in. You're actually just gonna have to click create an account with your information. I guarantee there are gonna be a few of you in here. It's not gonna let you make an account. The reason for that is if, when you first sign on, if any of the information we have doesn't match perfectly, it will let you make an account, whether, maybe your name's Benjamin, you went by Ben on one of the forms, or if you put your birthday in a different format or something. If that's the case, all you gotta do is call our office tomorrow and Cheryl will reset you in a couple of minutes and you'll be good to go. But for the rest of you, we'll try to get as many of you logged in tonight as possible. So,
You wanna go to create an account.
yep. Create account, and then I'll give you a few minutes to get logged in.
Enter that code because it is, make sure you. It's like. Right, right. I was just telling Jason here, there, some cases, if you're not able to reach or count, sometimes in our system, if your name and last, first name is last name are injured with all county letters, try that. Sometimes that's. Quite sure. Usually down. I probably. You try that backwards.
Everybody having issues over here, you guys all in it? Got it.
That's, I could be having on there, not going under something like that. Well, I mean, with that, like,
Right, I mean, somebody.
So there's an only thing is, Be over here. How are you guys? You're in, that makes sense.
You know, we grab this issue, but we all, like, we're all in.
I don't know that.
Yeah. I have. Yeah, exactly.
All right.
All right. So we'll give a quick demo. It seems like almost everybody's in. Any of you who, if you hadn't forgot your password, and you can't get it reset from your phone, or if it's not letting you in, it sounds like we only have a couple. Again, call our office tomorrow and we'll get you reset in our system and you'll be able to log in. But want to walk you through a few, functions of Member XG. I know everyone's probably most excited about the dollar bank, balance. That's typically how it works. But this is essentially, you know, a test local 400 member we have in here, so we can, you know, show you essentially how the website works. The first tab is going to be demographics. So this member is married with 3 kids. As you guys are getting married, I don't know if we mentioned or not, all we really need to add your spouse to the plan is essentially a wedding certificate. And then, you know, obviously a few other pieces of information, with the wedding certificate's the big one. And when you're having kids, it's the birth certificate is what we need.
And it's just a copy.
Right, yeah, we don't need the real one. People ask a lot when they're having kids, you know, do I gotta call you guys right away and try to get the kid on the plan? Obviously, there's medical expenses associated with that. And the answer is, don't worry about it. Get it to us when you can. And what we'll do is we'll actually retroactively go back, say you send it to us 2 weeks later, we'll go back to the date of birth or the date of the marriage and we'll pay any claims that happened in that time. So I always tell people, you know, if you're on the dance floor of your wedding, don't try to send us an email with a marriage certificate, just enjoy it. If you have dependents, whether they're a spouse or a child who are 18 years or older, they are not going to show up here unless you sign a form with us. Well, they sign a form with us giving you permission. It's a HIPAA law. It's because this is technically protected health information. And even though they're your dependent and you're paying the claims, you can't see that information unless we have their signature that that's okay for you. So
That also includes the spouse.
correct.
So the member should only at this point see him or herself or an underage dependent child. The spouse is not going to be on there and adult age dependents are not going to be on there.
Correct.
We need permission from those individuals to give you the opportunity to view their claims.
So this is the demographics page. This page will walk you through different deductibles. So, you know, this individual's deductible at $1,000. Obviously, it just started over in January, haven't had any claims yet this year, haven't paid anything. You'll see applied to local 400 individual deductibles, 0, long remaining 1,000. Obviously, as the year goes on and there are claims, those numbers will change until you hit that deductible. And speaking of claims, another one of the more important tabs, in my opinion, is the health claims tab. So as soon as we get a claim on your behalf, as soon as it hits our desk, it goes into our system and you're gonna see it on here. Now, it may not show up as processed right away as all these do. It may show up as, pending or in status. And you're gonna see basically every update. See for, we'll take this claim, for example, on December 8th of 2023. The billed amount was $124. Plan paid $40. The participant would have been responsible for the rest. The green plus buttons over here, that's gonna show you like the true details of the claim with the
I
medical
should be able
codes.
to click on it. There you go.
Yeah, there we go. So this, in this case, this is just a member dollar bank reimbursement. So, and that'll show up here as well. This person had a member dollar bank reimbursement of just under $24.50. I will actually be able to see that as well, when we go to the dollar bank page. Eligibility is gonna show up here, so depending on when you're adding dependents, these lines could change. Looks like some of, obviously, if we go way back in time, it started with just the member. As a pre-apprentice, went to the active plan. This may have been before it was Plan B plus, so we're back before the current offering, and that's why sometimes these line items change, even though there wasn't necessarily a break in coverage. Chuck added Henry, you can see right here in the middle of April 2016. And then it looks like added Lily in 2019. And you'll see right here as well, Plan B plus one stick. And this is for 2020. So at some point, this member had a stick penalty. They had failed to do the biometric screening. The work history tab is actually pretty close to the dollar bank tab. They show a lot of the same information. But I know Jim mentioned this in the earlier class. Local 400 is very fortunate to have a great group of contractors, and there are not very many mistakes made in them reporting the hours that you actually work and sending the correct amount of money to us to post on your behalf. Let's say you go in here and where, for July of 24, it says 204 hours. Let's say you actually think you were 240, right? And maybe in June, where it says 134 hours work, you think you actually worked 160. Give us a call. We will obviously look into it with the payroll department at whatever contractor the issue is with. Again, it does not happen a lot, but this is where you guys can take a little bit of ownership on the hours you're working and the dollars that are being remitted on your behalf. And I know, Jason's mentioned too a lot of times, but especially if you're on the road and you're outside local 400, making sure that reciprocity is coming back on your behalf as well. And you'll know if we're not getting money on your behalf, because we're going to be sending you notices to make self-payments to the health fund. And if you're working, you shouldn't be getting those. So when that happens, we usually get a call pretty much right away and we get to the bottom of it. But there's a tab for disability payments here, and I should mention you do have a short-term disability benefit through this fund. So if something were to happen to you where you cannot work because a doctor has said you cannot, for up to 6 months, you can get a benefit through Local 400. And there is a weekly benefit that's paid out to you, as well as your eligibility is you get a credit for your eligibility during that time you're out. So let's say you're out 2 months. I should say the maximum you can be out is 6 months. But let's say you're out 2 months, you're gonna get paid short-term disability from the fund, and you're also gonna get credit towards your health coverage for those 2 months. So we're not gonna pull your dollar bank down 2 months worth of eligibility, because we essentially credit you for 130 hours work while you're on short-term disability.
And I believe the short-term disability benefit is 66% of the,
Current
your
rate. Yeah.
current net rate.
We're at $1,000 for treatment, $750 for.
Yeah,
All right.
I think it's 1,400 for attorney. I think so.
When your rate goes up, so does this.
Maybe. I think so. Yeah, looking into this, yeah.
Anyways, it's a,
Yeah,
it's a
It's
good,
indexed, so.
yeah, it's a good benefit.
Right. So you see that here, now what I know you all wanna look at here is your member dollar bank balances, so I'm gonna be frank. A lot of times, this page is very complicated to read and understand, so I totally get it, if you guys have questions. It's harder to look at on your phone than it is on the computer. So one thing we found is if you actually turn your phone sideways, you can see every column. If you're holding it straight up, a lot of the times you can't, so, easy way to look at this. Now, this individual, you'll see the rate here says 890. This is because if you look at the work period, 2024-1, that was in January of last year. Your hourly contribution rate didn't go up to 940 until June. So you'll see if we scroll down, that 8.9 goes up to 9.4. But really, it's all, I mean, the function is all the same. So in January, this individual worked 204 hours. 204 times 8.9 is what equals this 1815.60. The dollars column, that is how much money goes into your dollar bank for that month. But what it doesn't take into account is how much we have to pull out for your eligibility. So in this case, let's say your eligibility was that 1222. Really what your dollar bank is gonna grow by is 1815.60 minus 1222. And also, I know I said this is back before the rate went up, so that 1222 was, I think it was 11 something, 1132 or something at this time last year. But the confusing part is this final column is bank, that's how much money you have in your member dollar bank. And when you look at, if you look at this top right column, or top right number, it says, 10,174. That's how much was in your bank at the beginning of this line, at the beginning of January. Then we add in the 1815 minus whatever your eligibility was to get this total number on the next line. So there's kind of a disconnect. If you want to read it straight across the page, you can't. When you get to the final bank number, it's always 1 month after the month you're looking at the money going into your account.
So in our afternoon session, a number of the guys already had their December contributions posted, which is great. So if you looked at the January 2025 line and you looked at the column furthest to the right, that dollar bank column, that's your dollar bank balance as of today. That's what you're working with.
And another thing to remember is, you said there's a 2-month floor in there. So you have to kind of mentally take that 2 months worth of eligibility out if you're trying to think of how much you actually have
For reimbursement.
for reimbursements.
Yeah.
Another thing too is, if you're somebody who checks this every day, there might be a time where, and I've had this question recently, which is why I want to bring it up. If you're wondering why it maybe spiked quick and then went back down, or the other way around. So let's say we get your contribution. We'll go back a week to the middle of January. Jim mentioned your employer had until January 15th to get us the money from your December worked hours. So if you maybe looked on January 16th, we may have just gotten your money, and it may be, let's say it's $2,000 we got on your behalf because you worked a bunch of hours in December. If you look January 14th and January 16th, your member dollar bank may have jumped by $2,000. You're thinking, great. If you check a few days later, once we pulled the eligibility that money is paying for, now maybe it only went up by 700 or 800. You're like, why did it go up and down? I didn't do a reimbursement. That's because we're pulling for eligibility first. So if you ever see a spike like that, I know it's hard to explain. I admit that, but that's what it could be. If you ever really just want to know the total amount you got that you can be reimbursed for at any given moment, call our office and we'll give you a hard number. Yeah.
Sure.
It says excessive, no contributions. Excess no contributions, it's like takes money out of the.
Yeah, so I obviously don't know what your bank is, but my gut tells me that you had, you're above the threshold.
You were above that 12-month
Yeah,
12-month ceiling?
I have like negative 160 hours.
We'll have to look into that.
Yeah.
Are there any questions, guys, on how this works? I know the dollar rate, screen can be confusing, especially once you start taking reimbursements, but last thing I'll touch on here, and this is actually goes back to that packet we skipped over, is this Med Expert, tab here at the bottom, and I can't demo it because there isn't a way for us to demo Med Expert unless it's with a real person. But what that is it's actually a government requirement from a few years ago we had to put in. Let's say you need a procedure, you need your knee. There you go. You need a knee replacement. Well, likely you don't know who's the best person to go to. Maybe you don't know who's close, who's in network. You go into Med Expert, you'll have to make a separate account for that too. But it's gonna know who you are. It's gonna know you're part of Local 400. So it's gonna also know the geographical area that you're living in. Type in, I need a knee replacement. It also is gonna know what you paid towards your deductible, your out of pocket, what your likely expenses will be for this knee replacement. And it's gonna give you a few options, and it's gonna base it on, again, one, who's in network. It's gonna base it actually on the ratings this specific doctor may have received. It's not gonna give you, a guy with, 1-star rating.
Be a brightness.
And it's gonna give you, like I said, a few options that are close to you. So it's a cool tool if there's already anything like that. Also, if you don't want to go through Med Expert, you can call our office and we can do that for you as well. So
It's actually kind of neat if you're going through some kind of voluntary surgery, knee surgery, shoulder surgery. We see that all the time because it provides you not only with options, but it also tells you how much you'd have to pay out of pocket if you go through any one of those three options. So it's almost like shopping for a car ahead of time. I mean, that's always been the argument in the healthcare industry, which is it is the only service provider where you have no idea what you're going to pay until after everything's done. All of a sudden you get a bill in the mail and you go, what? So the government took it upon themselves to say, no, that's not how we should do business. We should make sure that individuals like yourself have an idea going into this, how much these particular services cost. So you can make an educated decision as to which option you want to pick. It's a great tool.
that is all we have for you guys tonight. Are there any questions? Again, Jim and I will be here for at least a little while. If you have any, private questions, but yes.
Before you were going through that list, of all the things that it covers, you're saying that's on your website, where you go find it?
Good question. So if you go to links, under Local 400 Health Fund, links, it's gonna be this one right here. Is that big enough? The EBA healthcare expenses table. And this password listed under here, you're gonna need it once you actually go to here. You have to type in that password, into the here to actually get to the list.
And it's going to give you all 42 pages.
Yep. Anything else?
All right, listen up. Before we conclude this, we do have the blue cards up here, the harder plastic durable ones for Prevea, as well as we have the sign-in sheet. I'd ask that everybody who's a student in this class, please sign in.
Yeah.
Oh, also, guys, I got some cards here if you guys want to grab one. If you ever need to call after 4:30 when our office closes, call the number out here.
All right.
Also, Brett Fontaine, right here. That's your Eric Feed,
Actually, I had a question.
Yeah.
Eric Seed here.